The following is a demonstration of a healthcare provider meeting with a pregnant adult who is currently in treatment for their dependence on other substances. This person is open to quitting tobacco. Notice how the healthcare provider applies the 5 A's: ask, advise, assess, assist, and arrange of tobacco cessation counseling.
So I saw in your questionnaire that it looks like you said that you vaped before you were pregnant and are currently vaping.
Yeah, I am working to stay clean from other substances, but I can't give up the nicotine. I mean, I know it sounds bad, but I mean, I can't take away everything at once, you know?
First of all, amazing that you've been able to stay away from other substances. That is a really huge accomplishment. You should be proud of yourself.
Thank you. Yeah, it's been tough, but I mean, I wanted to be here for the baby, so.
Absolutely. Yeah, that is the best, amazing motivator. And it sounds like your recovery, from other substances is, the most important thing to you.
And honestly, vaping has been so helpful when, like, it's gotten hard in recovery. I can't even imagine not having it, to be honest.
That makes sense. If that's been your way to cope for a really long time, it's hard to imagine we's without it. It sounds like with your recovery being the most important thing, would you maybe be interested in hearing about what we know about the impacts that using nicotine has on recovery from other substances?
Sure. Yeah.
So, one thing that we know is when you are able to quit all tobacco use along with quitting other substances, that actually increases the likelihood of maintaining your recovery in the long term by 25%.
Oh, wow, that's kind of surprising. I mean, I would expect it to be the opposite.
If you think about it, when in the past or the times when you typically would smoke or vape,
Yeah, I guess that vaping and using do go hand in hand.
it sounds like being that, again, your recovery from other substances is so important and that you're wanting to be here for you and your baby. And, you're in the program right now and you have more support probably than you've ever had before in terms of, for quitting vaping. Maybe now could be a good time. Would you like to try to set a quit date?
I mean, that is true. I made a lot of progress in my recovery that I'd hate to lose. And it would be nice to be free from everything, including vaping, for sure. I mean, it's getting expensive. But I've tried to quit in the past, but it just has never worked. But I mean, yeah, I guess we could try again.
That's great. I'm so glad that you're open to quitting. And you're right, tobacco use can get really expensive. So being that you're open to quitting, what we can do is we can start to work on a quit plan, set a quit date, and kind of work with your counselor to start cutting down ASAP. Does that sound like something that could work?
Yeah, I can definitely try that.
So I have here a quit plan that has lots of really specific information for folks who are in recovery and are pregnant and are currently smoking or vaping. And so we can kind of work together to personalize this for you. And then the other thing that we can do is, in addition to your counselors here in the program, there's a great service called Quitline NC, which provides really experienced quit coaches who have a lot of experience and training in terms of helping people who are currently pregnant to quit vaping. You can access Quitline NC 24 hours a day, 7 days a week, and it's not just calling. You also can do texting and get all of the coaching via live texting, as well as online chatting once you register. That could be another really great support for you.
I mean, anything that helps. In the past, I've just tried to quit on my own.
Just like quitting other substances, it is really hard to do. It takes, a lot of support from other people in a supportive environment to help with quitting. So really glad that we can work on this together. The last thing we should do is arrange a time to follow up on this also, to see what's working and what's not. So how about a week from now, you can follow up and see how that quit plan is working.
Yeah, for sure. Thank you.
Visit YouQuitTwoQuit.org for free resources for your practice, including training on evidence-based tobacco use screening and cessation counseling, technical assistance for implementing the 5 A's and 5 R's in your setting, as well as educational materials for healthcare and allied health professionals and patients. That's YouQuitTwoQuit.org.